Welcome back. There have been challenges getting people vaccinated. Some have to do with vaccine skepticism. Most, though, have to do with access, and that's an issue in some of the more rural parts of our state. Here to talk about what's being done to get people their shots is Dr. John Graham. He's the Vice President and Chief Medical Officer at Day Kimball Hospital in Putnam in the northeastern part of our state. So, Doctor, tell us, how's things going out there?
Well, overall, I think things are going well. Fortunately, we did get off to a good start when it came to the vaccinations. The response in our community has been amazing. We've had multiple venues that can supply vaccines. Day Kimball Hospital itself has been supplying vaccines to our staff, but that has expanded into our community. Our medical group, it's called the Day Kimball Medical Group, is participating also separately and supplying vaccines for patients that actually go to doctors in our group, and they've been able to get their vaccines straight through their medical practices. We've had at least one very large area down in the Plainfield area that was successful at supplying, I think it was over 1,000 vaccinations in one day. It was a Saturday, and it was very successful, and we opened it up to a wide range of age populations. So I think overall, as a grade, I would say we're doing great, but we do have challenges, and VAMS, which has been true across the country, we are no different. Getting registered in VAMS, and especially in the older age groups, has been a challenge. Initially, we were able to have patients come in, and we would take their information and we would insert it into VAMS. But we have now converted to a system where patients have to get a scheduled appointment through VAMS. And there are ways of patients getting educated. The state of Connecticut has been very good about getting the word out. And so patients are able to call certain numbers in order to understand how to get registered. So we've been taking advantage of that lately.
I want to ask you about that, Dr. Graham, about getting the word out, because it's probably different for your population than it is in other parts of the state. We've covered, a community center in Hartford where they try to reach a densely populated neighborhood. We did a spot on this show a few weeks ago where the Bristol Health Department was going door to door to bodegas and to shops and talking to employees and customers. Is it different in a more sparsely populated part of the state? How do you reach those folks that you need to get to and educate and tell them what to do? What has your strategy been?
Well, I think I wouldn't call Northeast Connecticut densely populated. So I think the word does spread quickly in this area. I do think education through the airwaves. We have a local radio station that is very, very helpful in disseminating information. It's called Winnie, W-I-N-Y, has a great way of getting the word out in our community. So that's recognized as a source of information. So myself and many other members of our team here at Day Kimball Hospital have been able to get on the local radio station and get the word out. And in the case of vaccinations, it has been very successful venue to be able to get that message. I would give that as probably the number one method of getting the word out. And it's amazing how fast it can spread. We have some periodicals that also are very popular in our community. There's a shopper guide that comes out on a weekly basis. And, we have often used that as a way of educating people, especially in this time of the pandemic. So we do take advantage of that. And I think people are very good. And our medical group have contacted all of their patients and left messages on their voicemail machines to alert them that vaccines were being distributed through our medical group offices. We have multiple locations in Northeast Connecticut, and I think the patients have responded to that. So I think it's a combination of all of the above, but it's going well.
How much of an issue is vaccine hesitancy among your population? Is it more letting them know about access and the availability, or do you have people who are skeptical about this and say, Dr. Graham, you got to tell me this is safe and how I can believe you? How big of a conversation is that in your area?
Well, yeah, I think that there are conversations. I must say that I think our leadership here at the hospital, through the hospital itself and through the medical staff, have really, from the very beginning, gotten the word out. In fact, we have led by example. So 100% of our medical staff here at Kimball Hospital are vaccinated and have been vaccinated since, I would say, the middle of January. We've been receivers of the Moderna vaccine, and we spread the word. We got the word out to say our doctors are doing it. Why can't you? And at the same time, educating them.
I want to ask
inside
you,
of our hospital, our rates of vaccination in our staff are up to, I believe, the latest number is 77% of our staff have been vaccinated. And again, I think the population, the community hears that the people that work here are doing it themselves. And I think that's been a great example. And I'd like to think, and I think it has been, a way of reassuring them that this is safe and it's the right thing to do.
Certainly a powerful message. We're all out of time, but I just want to ask you briefly, we saw this past week the Johnson & Johnson pause. You still have appointments available out there in northeastern Connecticut?
We do, fortunately. Of course, we've certainly not supplying Johnson & Johnson at this time, but luckily we do have the Moderna vaccine available. And so we actually had two Johnson & Johnson vaccine clinics set up this week, but we were able to switch them over to Moderna vaccines, and our number of people still have shown up in spite of it not being a Johnson & Johnson. They have shown up in large numbers. So It really hasn't affected our clinics. So we're moving strong. Our numbers are large, and we're anxiously awaiting when Johnson & Johnson results are brought forward, and the guidance that will come with that certainly will help us.
All right, Dr. John Graham from Kimball Hospital, thank you very much, and keep up the good work in northeastern Connecticut. Our Sunday Spotlight is next. We'll be right back.